So today I could be seated here and I feel I need to see a doctor. I could grab my phone, look at the best price, be able to do a teleconsult, and be able to have the doctor consult tomorrow or today afternoon. And to me, I think that is our vision of how do we reduce the barrier between doctor and patient, and provider and patient, and service delivery partner and patient. And that's how Ponea came into being. One of the things we looked at is one thing that also baffles me constantly is there's so much conversation around five-star hotel services. So even you go to Kisumu today, or you go to Nakuru today, or wherever you go, or even you go to Mombasa, there's always a hotel, even a 3-star that says I'm a 3-star hotel offering great customer service. But I've never seen that in hospitals. I've never seen that in care, in healthcare provision. So I'm not sure why are we so keen about lifestyle services, but when it comes to our health, we don't see patients as that critical center point in terms of delivering that key patient experience. And for us, we realize that, look, I may be lucky and have a personal assistant who books my appointments and is able to make sure that I'm there just at the right time, see the doctor, such that I don't have queues, I'm not there in the queue for a long time. That applies to a very, very small population. But take a mother who is 28 years old, she has to work, her baby is sick, and she has to go see a doctor, or she has to go to hospital. And she's gonna be in that queue for 2 hours minimum in most cases. Now, to me, I think that anybody in a certain in life should be able to have that VIP patient experience. And that's how we first started talking about having a Ponea concierge service for the patients. What does that mean? It improves efficiency, because you could call, and so long as we can change habits, we can say, for instance, we'll make sure by the time you see a doctor, it will be 2 o'clock, will be 2 o'clock. We also make sure that we change patients' habits by making sure that when you say you're going to be there at 2 o'clock, you're going to be there at 2 o'clock. And let's think about what has happened in the hail raiding sector. In the hail raiding sector, what has happened? Ride-hailing sector. What has happened in the taxi business, and you look at what has happened in Uber and everything else. 4 or 5 years ago, if you were looking for a taxi, you most likely would have woken up at 7 o'clock, called a taxi, knowing very well you'd be out of the house in 1.5 hours. Today, what happens? The same taxi you call when you're putting on your shoes is the time you call a taxi. So think about what has happened. It has changed the way the taxi person, the taxi operator operates and thinks about patient centricity. About customer centricity. But it has also changed our mentality when we call for taxi, because then it means the taxi is not going to be there waiting for you for 35 minutes. That alone has then improved efficiency in services. It reduced cost, right? Because it's on-demand service. If healthcare could also undergo that kind of level of transformation, naturally, it will reduce cost, it will bring a high level of velocity in healthcare services. The caregivers are going to see more patients because there's more efficiency. The cost of service may drop, and also mobility in terms of offering services on demand. What stops a doctor coming to your house today? Younger doctors want to come to your house and offer you a service. Nothing stops that from happening. A nurse says to come to your place. On-demand beds. Should you be in a hospital for the next 1 month, when really you can be there for 2 weeks, and there are other 2 weeks that you have a nurse coming to see you? Again, sparing, allowing other people to use who really need the bed space to be able to go to hospital. So again, these are all the kind of conversations we have in terms of patient concierge. So patient concierge is just the next generation of delivery of healthcare, allowing patients to really find find themselves seeking services without having to feel the pressure of having to think the waiting time, or will this doctor, is it the right doctor, is it the right facility, is that x-ray working? That is what we bring to, that's what we call our patient concierge in Ponea. We also act as a concierge for the doctor, because the doctor, think about a doctor who is operating and knows that he had booked, he or she was not aware how long they're going to be in theater. and they were meant to be out by 2 o'clock and have an appointment at 3 o'clock with some of their patients. Something happens in theater and they have overrun their meetings. What happens to the patients? Our concierge also is able to work with the doctor to be able to reprioritize all their patients, and such that doctors can feel we're almost like a virtual concierge for them. So this, to us, this is not only about patients, but also for doctors, also facilities. You go to a facility, yes, we agree that sometimes you have significant traffic in some facilities. And you wonder, like, how will I maneuver this maze of traffic here? So think about, we have on-site concierge teams that then help the patient navigate, our Ponea patients navigate across the hospital. Because some of these hospitals and some of the caregivers, it's a complex situation because you're handling primary health traffic in some of those big facilities. You're also managing referral traffic. So sometimes the whole mix-up in many facilities creates some sense of confusion or some sense of disorder as you go to some of these facilities. Yes, we've seen facilities that have moved into malls, into higher end premium areas. Yes, but that is one side of trying to address the problem, right? We still think that the concierge that we offer on site, we offer for the patients, we offer for the doctors, creates a differentiation in enabling you to have more efficiency in health-seeking behaviors for patients.
We have a sales or a growth team, and we have a clinical team. The two do not influence each other, as in their targets are different. The sales team's job is to essentially go and pitch to healthcare providers, explain the value proposition, and convince the doctors that this is a good business deal. But once they've done that, right, the healthcare provider buys into the value proposition, and they sign our a 60-page contract, a service level agreement, which has quite a lot of compliance requirements in there. Once they've done that, then the separate clinical team takes over, led by a completely different team lead, and they're all clinical people because they go and vet the facility, the doctor, the credentials, the equipment, everything. So that's the approach we take, and I think the other thing to add is that, Mike, when we started this whole journey, we were looking at the universe of doctors registered in Kenya is about 13,000 doctors. But then we narrowed that down to like less than 900, right, who are recognized and covered by the top 10 insurance companies. And now we further reduced that number to a number that we think can represent the best of the best. Because we just don't want a bad experience for a single patient to spoil the reputation of Ponea. So every single doctor for us on our platform is as good as the reputation of Ponea. So there's a lot of, I would say, governance and reputational motivation that we have to make sure that we don't have not just quack doctors, just doctors who are subpar or below average. We just don't want them on the platform.
To add to what Akshay is saying, if you look at the role of marketplaces anywhere, the number one thing is actually to drive trust. And driving trust comes from curating the parties involved in the transaction. So if you, for example, look at the ride-hailing that has been cited quite a bit, you'll see that the whole thing of driving trust between a driver and a passenger comes from the ratings that happen. And we have that in Ponea, so that every time there's feedback about a provider or a facility or a doctor, it actually comes back and it's visible to the other potential people who would book. So really, that element drives a lot of discipline, and we'll see as more bookings happen, all the providers on the platform will start becoming more conscious about what is really happening to them every time feedback goes out. So what you'll see is that feedback is no longer scattered in the social media world, but is actually, you can find it within one single platform. And that is a critical part of improving healthcare quality. in our nation.
But also I think one of the things you also to look at, I know we keep insisting about doctors. It's also appreciating that our vision was not about doctor-patient connect only. It was understanding the continuum of care. And I think that's where we differentiate ourselves as a brand and also as an organization, because it's complex what we're trying to do. We are connecting, if you think about it, we are connecting doctors as specialties, doctor with different specialities, all the way from GP to very complex services, whether it's cardiologist or gynecologist. Then we're also connecting, as you know, a marketplace. We're connecting labs, independent labs. These are labs that are run by entrepreneurs. And we are a very entrepreneurial African nation. Where somebody says, I'm going to create this lab. The guy is a lab tech. He gets investors, and he builds a lab. And it can be somewhere in a suburb, in another town. It could be somewhere out of the city. But that lab works. That's the reality. It works. The guy has skill. He got investors. He brought people together. He bought equipment. He bought lab techs, and he's building that lab. Then he also got people who do diagnostic centers. Somebody has set up an X-ray, an MRI, a CT scan, all in one center, somewhere in Upper Hill, somewhere in Kikuyu, somewhere in Kiambu, whatever. That's another entrepreneur. Then you've got another entrepreneur who set up a special clinic, which is chronic disease management. I do kidney dialysis. I do blood sugar. I do nutrition. I do physio. Those are all different kind of entrepreneurs that are also delivering different kind of service in the healthcare. And you've got also nurses. Today, some nurses have set up their own independent practices. You could have nurses that come to you to give you, who team up with doctors, chronic disease doctors. That chronic disease doctor is able to connect with a nurse who's able to deliver that service, and then say, please go see my chronic patients and do X, Y, and Z intervention. And then you've got pharmacies. A pharmacy that runs independent. The guy has been running this pharmacy for 20 years independently, another guy for 10 years. I'm not talking about big chains. I'm talking about these guys who have been running their own independent pharmacies. All these guys is what we call entrepreneurship in this medical sector. All of them are running some level of an enterprise, whether it is faith-based or whether it is NGO-based or even based by a simple fundamentals of, yes, I'm passionate about healthcare. Either I've got passion, but I've got investors. These are all ecosystem players. And if you think about a hospital is a combination of all those things, which is outpatient, then inpatient, which includes theater, ICU, everything else. Our vision is to play in the outpatient space. That's what we're doing, because that's why we think significant disruption needs to be brought in terms of fraud, management of fraud, in terms of efficiency, in terms of making sure there's price comparative or comparison amongst players. So when you bring all that together, all those are entrepreneurs who need to be brought in to come together into one global platform. And that is, I think, how the whole rating system works. You're a doctor, you rate the doctor, you rate the lab, you rate the diagnostic center, you rate this. At any one moment as a patient, you've got multiple areas you're rating. And that then creates through an algorithm the numbers in terms of rating information that we bring forward to a patient when they're booking on our e-commerce platform that we are going to be launching soon, that allows you to book, to compare prices, to look at who is the best at offering this service. This guy's got a 7-star rating, is 2 kilometers from me, price point is here. You need to make a decision. You can make a decision based on those variables. But at the same time, we also do our own rating. Our own rating is very important because we then send our clinical teams. We have a big clinical team of doctors that work with us. And part of their mandate is to go also do what we call quality check in the provider. So we have a quality check mechanism, which we publish. And we'll publish it also on our online e-commerce platform for you to understand how do we rate our providers. Rate our providers based on facility, based on quality of doctors. We also rate them, and we rate them on a monthly basis. We even do things, we even send sometimes mystery shoppers to go there to the facilities every month to understand how was the experience for this consumer, for us and for this patient. For us, I think that is the differentiation in terms of how we onboard our providers. Because at the end of the day, in a marketplace, it's about trust. It's about quality of service. It's about at the right price point, right? It is convenience to you. It is how confidential the teams are and how discreet can caregivers be. Because at the same time, some people don't even seek health care interventions because of privacy issues. So how can we still give you a healthcare intervention even from your home, right? Even if you're VVIP or you're sort of wondering what my family will say about my condition. These are things today using technology we could offer. And I think that is where, it's a great question because that is where the rubber hits the road really.
If you really look at the e-commerce platform that is just about to be launched, a couple of things will be in there. So most of actually all the services that Ponea provides will be there, from diagnostics to being able to book a doctor, to being able to book a physio, quite a number, the range of services. And that just brings the services closer to everybody. And I think we saw within from this year and last year as COVID hit, and a lot of people were starting to want to see doctors remotely and be able to book their services remotely. So the first thing that the e-commerce does is actually to bring the services closer to the people. The other thing, and very important from a marketplace point of view, is to drive price discovery. As Mike has just said, you've got a doctor based, say, in Lavington that is charging for a service, 8,000 shillings. Then you have another service based in Dagoretti, which is about 5 kilometers away, that is charging 1,000 shillings. So, and the same quality, why should the person pay more because they're in Lavington, yet they're just 5 kilometers away from the other service? So that price discovery is one of the magic equalizers that marketplaces bring, because it helps the person who would not have discovered about the alternative cheaper service to actually discover it. And so price discovery will be a critical element in the next stage of Ponea. Something that has actually not happened yet. But as that happens, as the range of services increases on Ponea, as more participants in the marketplace, as service providers increase with different price points, we will start to see cost of healthcare drop significantly. So those two are key roles that the marketplace will play.
If I can also add, I think there's a third role, which is about accountability. If doctors are not getting rated, and they do malpractice or mismanage the patient or don't provide the right diagnosis or treatment, who holds the doctors accountable? So at least now patients know that if they are booking a doctor through a Ponea platform, through the e-commerce platform, these are healthcare providers, doctors, nurses, labs, all of them, even pharmacies, are being held accountable, and that is great peace of mind for the patient.
Anybody can access our services. When we launched in December, it was quite strategic for us to launch with our concierge services, because I think the first thing is to understand the market, understand what patients are looking for, understand the interaction touch points. It's great to say we can fully automate technology, healthcare from end to end, yes, but we need to get to a point where there's also a culture transformation. It's a combined journey, where as people are getting more and more to trust the system to a point where they can fully operate with the system without human intervention. That is a journey that takes time. And I think in any marketplace. So the first thing is to have the human touch of delivery of healthcare with a combination of technology and data. And that's what the first thing we've done. And it has been quite successful because people call our call center, we understand the problems they're facing, the kind of questions they ask. And as they do that, you refine your product further, right? You understand what they're looking for, the kind of things people call for, at what time of the night people call for interventions. Remember, you can't sell healthcare like you sell alcohol on e-commerce. It's a different conversation, right? So you need to understand when somebody is calling in on an e-commerce platform or buying alcohol on an e-commerce platform, the emotional connection that they have to the platform, and when somebody is seeking healthcare, are two different things. You're in a different emotional state. So you can't define the product in the same way as you're buying a B2C product, which is defined. Healthcare is not defined. It's not like you're buying an iPhone and saying, look, I want an iPhone 10 on an e-commerce Amazon platform. In healthcare, you're buying an experience. You're going to buy a result. You're talking to a doctor who you hope is going to give you a result. So the result is not defined. The result is you hope you're going to feel better. That's really, you're not buying a product where you know iPhone 10 can do X, Y, Z. In healthcare, you're buying an intended position end game you're thinking about. So it's also very mental. And there's need for human intervention there. And that's where we started with a Ponea concierge, helping us understand how do people perceive health and how do they look at health in a digital marketplace.
If we look at the sort of patient population, we know that the status quo currently today is probably less than 5 or 10% of patients are accessing healthcare through a digital platform. Majority are just going to pick up a phone and call a hospital, call a doctor, call a clinic. So we wanted to start with that, right? Ponea should be as easy as picking up a phone and talking to someone. But the person they're talking to is a Ponea concierge. That changes the whole experience. Then we transition further to those patients who are maybe a bit more tech savvy. Your typical Amazon, Uber shopper, someone who orders their cooking gas from the GoBeba platform. They want the convenience and they're tech savvy. So Ponea then caters to them as well, which is like a self-service. And then as we go on, we might find that there are some patients who really not just want the convenience of healthcare, but also want to take full control of health for themselves and their dependents. Could be their parents, grandparents, children, grandchildren, and even their staff. Employers want to take care of their staff. So we're building it out in such a way that you can now start taking holistic care of everybody that you are responsible or you care for. Then we want to go further on this journey, where you now want to sort of even get to a point where you want to automate some aspects of your healthcare. So maybe you'll start getting Ponea wearables, that'll keep track of maybe your physical exercise, your heartbeat, your ECG. And so now when you actually do go and see a doctor based on some symptoms, there's a lot more data available based on which to make an informed diagnosis. So this is a journey that is going to span, quite a wide population of people who want to take control of their health and those that they care about in different ways, from the very basic to probably people like me and Peter, fully automated. Like, we just want tech to keep us healthy. So it'll cover everyone.
Apart from the patient, is also looking at, and Peter can speak to it, it's also driving change in the way we think, how we help entrepreneurs in the healthcare sector launch. So think about a doctor who is 29, 30 years old and wants to launch their practice. How much infrastructure do you need? Maybe today you need technology to do teleconsulting. You don't need so much real estate, right? Today we talked about shared offices, right? People have got shared offices. Today, whoever is going to build shared infrastructure for doctors, all they require is technology like Ponea to bring traffic to you. So having more doctors who want to become entrepreneurs will also drive that whole change. So one of the things we promote in Ponea is the launch your doctor practice, or launch your practice, allowing entrepreneurs, doctors to be able to, or doctors or lab technicians or radiologists to launch their businesses. Nothing stops them. If Ponea can provide technology infrastructure to back them and to bring traffic for them, they don't have to invest in complex, very expensive infrastructures, because Ponea provides that ecosystem. So to us also, that's one revolution we are hoping to see, to drive more doctors to become more entrepreneurs. And that's something we are hoping to see. Yes, people have all these side gigs every day, but why can't you officialize your side gig? You've got customers, yeah? Why can't you just make it? Why don't you use Ponea to finally say, look, my side gigs are official. These are my customers. These are their patient records. I see them. I've got a virtual place. I see the customers. I can do it online and drive. Let them finally say, this is my gig. Because eventually you move from side gig to main gig. And from side gig to main gig, you'll still need an infrastructure, patient information, patient records that you need to go with. And that to us, it's important. If you do your side gig, officialize it, such that also patients can rate you in your side gig.
To add to what Mike has just said, and you look at some of the trends that the marketplaces have set in motion, and a couple of examples. You look at the development in the food industry right now, and you'll see that we're starting to have restaurants without an entrance, or AKA also called dark kitchens. Right? There's no restaurants on the door, but there's this strong virtual brand of burgers or sandwiches that is actually cooked from somewhere. And then people order it virtually and they connect with it, not because of where they go to have their food, but because of the actual food that is delivered to them and how food is good. So that is the same thing about Ponea, making young doctors who are talented that previously would have had to save for years in order to have enough money to have an infrastructure to bring in a door where people knock and come, and helping them launch what we could call in quotes dark practices, but in a lighter way of that they are not necessarily visible to you on the main street, but where you go to actually get those services, the service is great, and they can get a lot of demand through the virtual linkages that Ponea provides. And that means that they actually become good and get more demand for their service, because again, through our rating system, people rate them and they'll be seen as great practitioners. And so that part of building the infrastructure layer that is required for healthcare to become easier to launch enterprises in healthcare is such a phenomenal thing that we are going to do.
I wanted to add one more area around the question of who has access to Ponea. Back in 2019, before COVID, when we were looking at this, we were thinking the adoption of digital platforms by patients and also by doctors is going to take time, right? It will probably take 3 to 5 years of behavior change. Because of COVID, this whole thing has accelerated. Doctors who are older doctors who have been practicing for many years, who we thought would be the last, to get onto a digital health tech platform where they can provide services to their patients through virtual consultations, we thought they'll be the last people to get on. They actually need that service because they're trying to keep themselves safe. And then look at the patient side. Patients who would have probably never considered accessing healthcare consultations, either by thinking that, like some person is going to come home, or I can actually have a consultation over a video call, probably was considered to be a bit too geeky, or not for me, or it's for VIPs only, doctor at home, or a video call or a Zoom call with a doctor is for the young techie millennials. That all has gone away. And in fact, older people who really are concerned about not wanting to go out into a hospital scenario where they're sitting for a couple of hours surrounded by other people, this is so much safer for them. So I think we've really taken access to healthcare to such a high level, and we're going to see the impact of that in the coming months and years.